How many people know their numbers? No, not just knowing your height and weight, but there's a set of numbers that can tell you a lot about your health.
Knowing your numbers means that you are aware of your personal risk for the development of diseases like heart attacks, stroke, and heart failure. And so as a result of knowing those numbers, you're able to do things to help prevent the development of those diseases. There are 4 numbers that you really need to know as far as knowing your numbers. And the first is your blood pressure. The second is your cholesterol. When we talk about cholesterol, we're really talking about your total cholesterol, your LDL, which is oftentimes referred to as your bad cholesterol, your HDL, which is your good cholesterol, and your triglycerides. The third set of numbers that you really need to know is your hemoglobin A1C, or your fasting blood glucose, and that lets us know whether or not you're at risk for the development of diabetes, or if you have diabetes, how well your diabetes is controlled. And the last number that you need to know is your body mass index, and that is a number that we calculate based on your height and your weight, and it lets us know if you are underweight, normal weight, overweight, or obese.
Let's start with blood pressure, or the force of blood in your arteries as your heart beats. The American Heart Association says for the average person, blood pressure should be less than 130/80.
A normal total cholesterol is probably less than 200 or so, and for triglycerides, your number should be less than 150. Now, your LDL, which is oftentimes referred to as your bad cholesterol, the goal for that is really going to depend on what other risk factors you have for development of heart disease.
The third set of numbers you need to know is your blood glucose level, or hemoglobin A1C. The amount of sugar in your bloodstream can tell a doctor whether you're at risk of developing diabetes.
Really, a number less than, say, 6.5 would be considered normal. Diabetes is one of the really bad diseases that puts us at risk for the development of heart attacks and strokes and heart failure, and also leads to kidney disease, neuropathy. So we really want to try and prevent that if we can. And if you do have diabetes, we want to make sure that you're very, very well controlled.
And the last number to know is BMI, or body mass index.
So body mass index is a number that we calculate based on a person's height and weight. A normal body mass index is anywhere between 18.5 and 25, and that lets us know that you are in the normal range. It's important to have a normal body mass index because we know that as people gain more weight, as they become overweight and obese, they are at risk for development of lots of different diseases like heart attacks and strokes and diabetes in particular.
One more number to consider: your age.
As we get older, in general, our risk increases for the development of heart disease. So I would say older patients probably need to be a little bit more careful and have their numbers probably checked a little bit more regularly. If you're quite young and otherwise healthy, you can probably just get away with just getting your annual and making sure that you're fine that way.
Holly Furfer, CNN, Atlanta.